Hello, my name is Marine Zaimana. I am a senior at Bowdoin College majoring in biochemistry.
Hello, my name is Rahel Gaetana. I have graduated from California State University, East Bay with a Bachelor's of Science in Health Science.
Hello, everyone. My name is Umu Berry, and I'm a senior at Cornell University, majoring in healthcare policy. We are all members of the 2021 UCLA Public Health College Training Program, and our presentation is on Black maternal mortality in the United States. I'll start us off by talking about what is maternal mortality. Maternal mortality is the death of a woman during pregnancy, at delivery, or within 42 days of the end of a pregnancy from a related complication. According to the CDC, around 700 women die annually in the United States from a pregnancy or delivery complication. In 2019, the average maternal mortality rate was 20.1 deaths per 100,000 live births. The average, however, is not reflective of the different rates for different racial populations. Black women are 3 times more likely to die from a pregnancy related cause than white women. This is due to a number of social determinants of health, including transportation, safe housing, implicit biases, and structural racism. This graph was created using data from a CDC chart comparing the maternal mortality rate in 2018 and 2019 by race and Hispanic origin. As you can see, the overall maternal mortality rate increased between 2018 and 2019. However, the rate increased the fastest for Black women, from 37.3 deaths in 2018 to 44 deaths in 2019. Maternal mortality is a public health issue because maternal health outcomes are highly reflective of a population health, public health, and overall racial issues within the country. In 2010, the Office of Disease Prevention and Health Promotion identified maternal mortality as a key health issue. The United States spends more than any other OECD country on healthcare, yet it has the highest maternal mortality rate of any OECD country. 6 out of 10 pregnancy related deaths are preventable, and Black women are more likely to experience those deaths. Black women's heightened risk of preventable deaths spans across educational and income levels. Black women with a college degree or higher are 5 times more likely than white women with a college degree or higher to die from pregnancy related issues. Maternal mortality is a public health issue because preventable mortality is a violation of human rights, the rights to freedom from discrimination, and the rights to quality healthcare.
Social barriers and inequalities in the United States are key contributors to the Black maternal mortality issue. Some of these structural and social barriers include unstable living and food conditions, the lack of access to adequate medical care. In the case of maternal mortality, it can present itself as maternity care deserts, which are areas where women have no access to prenatal care. As seen in the figure, 2.2 million women live in maternity care deserts, including Black women. Limited to no access to transportation to and from hospitals, financial status. Black women on average make less money annually than white women and over their lifetime have a lower net worth, as you can see on the figure. The racial barrier is one of the biggest contributors to the Black maternal mortality crisis in the United States because of medical racism as a result of systemic racism. There are more socioeconomic barriers that contribute to and exacerbate the Black maternal mortality rates, but these are some key ones. Some ways we can work towards reducing the Black maternal mortality crisis socially are: we can begin by improving and elevating the quality of life for Black communities, which it can include increasing school funding for public schools, among others, enhancing support before, during, and after pregnancy for mothers and their families, identifying and addressing the systemic barriers to healthcare for Black communities, and encouraging conversations around maternal mortality and the anti racist framework.
Current public health efforts that are placed by the CDC has a list of resources for pregnant people, family, healthcare provider, hospital, community to reduce risk of maternal mortality. It provides pregnant people, families, and providers to educate themselves about urgent maternal warning signs during pregnancy, postpartum, and a year after delivery. This is due to the fact that symptoms can happen after a year of delivery. The CDC has placed an online training called Thinking Cultural Health to educate provider about cultural competency. The CDC also supports states that have enhancing review surveillances to eliminate maternal mortality program. American Rescue Plan Act 2021 gives state a new option to extend Medicaid postpartum coverage up to 12 months. The benefit of the surveillance system makes data collection easier and makes recommendation, promotion, implementation, and population-based prevention effective. The drawback of the surveillance are that it's not centralized. The three surveillance systems that are listed in previous slides have their own collection of data, which results for illnesses to be underreported. Also, there are only 25 states that are supported by CDC and are using the data collection programs. The class given to address implicit biases to aged care provider only lasts 2 hours, which might not be as effective. Studies have shown that implicit biases training might result in unintentional activation of stereotype. We would like you to support the Maternal Care Act. It would establish a fund for implicit biases training for providers and medical students. Supporting the Black Maternal Health Omnibus Act 2021 would give resources and funding to community-based organizations, create organization and policies to address Black maternal mortality. In order to maximize centralized and standardized surveillance system nationwide, have a uniform federal infrastructure, expanding the Preventing Maternal Deaths Act of 2018 would be effective. And lastly, supporting the Omnibus Act would increase doula accessibility by promoting doula services, which is associated with better birth outcome and satisfaction with care. Here, the graph shows that having doula during the delivery decreases using of epidural and extra interventions. Thank you for tuning in. And here is our acknowledgements and references.